Okay, so the next thing I'm going to be talking about is the health needs of children in foster care. So there is a significant unmet health needs of children in foster care. This is typically due to their deep rooted and complex trauma histories, compounded to their poor access to appropriate healthcare services. So, limited healthcare access and unmet health needs precede the placement and often endure in foster care. And so, it's really important to look at this as a whole and know that health is defined as broadly and includes medical, mental health, developmental, educational, oral, and psychological well-being. So those are all kind of health as a broad spectrum that we are looking at. It's pretty important. Essentially, all children in foster care have a psychosocial issue related to the family dysfunction. So there are long-term outcomes of foster care that have been inadequately studied, but national data does suggest that young adults who were in foster care as adolescents experience higher rates of mental health problems, unemployment, homelessness, low educational attainment, and post-traumatic stress disorder. It's really important to understand that. Also, and then some just statistics of overall 30 to 80% of children come into foster care with at least one medical problem. So that's really important to point out. And 1/3 have a chronic medical condition. So it's common for such problems to have undergone undiagnosed and untreated before these children even enter the foster care system, just because of the lack of access to health care in the situations that they're in. Um, and so children in foster care are more likely to change schools during the school year, be in special education, and even have a history of grade retention. So, all very important ideas. Also, it is really important to note that pediatricians in foster care will often be prescribing a lot of psychotropic medications for children with behavioral problems that were previously not diagnosed. And lastly, it is important to note that foster parents remain the major therapeutic intervention of the foster care system. So having a stable placement with warm, caring, nurturing, empathetic, and attuned caregiver is really ideal for the foster child. So the caregivers may have birth, adopted, and foster children in their homes at any given time. So it's really important to understand the environment that foster children live in.